I'm Tammy Johnson. I'll be showing you how to do a full or complete bed bath. I want to go over the items that you will need. You will have a basin, washcloths, soap, deodorant, lotion, gloves, a bath blanket, and towels. This will be available for you during the test. We will begin. Knock on the door, pick up the arm, check the arm bracelet. Hi, Mr. Smith. I'm Miss Tammy. I'm here to give you a full bed bath. At this point, I want you to raise your hands and say hand hygiene, because you have done that on another step. And then I'm going to pull the privacy curtain. Every time you pull a privacy curtain, if the skill requires water, you will then say, I will get my water at that time. This assures that you will not try to go get water when the bed rails are up or the bed's up. The next step is, and it's critical, is to raise all the bed rails, all 4 of the bed rails. I always work in nursing from head to toe, so I'm gonna get the side rails and then the side rail. I'm gonna go to the other side and I'm going to raise this side rail, and I will raise this side rail. Again, this is a critical step, and you must not forget this step. Going to raise the bed to a good working height for you. What I tell my students is that I shouldn't see them bending over and I shouldn't see them tiptoeing. Lower both the rails. Take the call light if it's across the mannequin, and I always put it under the pillow because that's pretty good place to put it so that it won't fall on the floor. I'm going to take the bath blanket and I'm going to lay it on the mannequin. Notice that I did not let it touch my uniform, and there is no shaking of the linens allowed. If we shake linens, this can spread not only bacteria, but lint particles that the resident could breathe in and cause them to get pneumonia. Loosely, put this on very loosely, but covered all the way, because when we turn them, we cannot have the state instructor seeing the backside. Okay, at this point now, I am going to pull the sheet down. Now, there's a couple of ways you can do this. Sometimes I tuck it, and sometimes I'll just hold it. But if you will pull it down just straight as you can, and this time, because we will use this method on many of our skills, but on this one we must go past the feet. Okay, and then let's get them covered back up. Now, if you've noticed, I have not put gloves on. This skill does not require gloves until we get to the peri area. At this point, I'm now going to untie the back of the gown, and I'm going to uncover the arm. Always hold the arm, support the arm at a joint. Pull that sleeve off, cover them back up, come over here, slip it off this side, try to keep them covered up, and then go up under the bath blanket and get your gown off. If it gets caught on the mannequin, just kind of lift them up. You're going to roll any linen away from you, and then you will hand this to your state instructor and she will put it into the hamper. Now, the table must be close to you. I should not see any bending or stretching to get your items. Every skill, I want this table close to you. You're going to put a towel across the chest. Now, there is a order to the bath, and I can send that to you on a list of the order of the bath later on in the class. Any skill that we use a washcloth with, except for maybe just a couple, we make a mitt. You lay it in your hand, you put your thumb, you wrap it around, you bend it up, and this, you have a mitt. How to do this is in your hygiene chapter if you struggle with this for a little bit. I'm going to just put water. Now you notice I never really got water. We just simulate it. So I've got water on my mitt, I've squeezed it out, and again, in nursing we work head to toe, far to near, and we always work with the corners, especially in the eye. We will use the far eye from the inner to the out, and then using the different corner from the in to the out. And then that's finished with the eyes. I'm now going to put water, I'm putting soap, and the face is washed in a circular motion. And then I'm going to get the washcloth that I use to rinse with. I really want you to get used to saying the word washcloth. I tell my students that this is a basin, this is a washcloth, it is not a bucket or a rag. So now I've got just rinse water, and I'm going to rinse the face. And then we always pat dry any area so that we won't cause any micro abrasions. So we've done the eyes and the face. Going to make the mitt again. Again, you put it in the corner. It helps if you keep your hand down. And I'm going to put soap on it. And I'm going to wash the far ear. I'm going to wash the near ear. And then I'm going to wash the neck. Then I will get my rinse washcloth. And I will rinse the ear, rinse this ear, and rinse the neck. At this point, I'm going to remove this towel. You can leave it on if you want to, but I'm going to remove it. I'm going to expose just the arm that I'm working on, which is the far arm. I'm going to take one of my towels. I'm going to make it length. Sometimes I shorten it just a little bit. I'm going to lay it on the bed. I'm going to lift the arm up. I'm going to put the arm on the towel. And at this point, I'm going to put the basin, which on a real person would look like this. But I just ask you to put it right there just to kind of pretend that the hand is in there. I will make my mitt. I will put soap on it. Now, on most body parts, we work from the head to the toe, but on this one, I'm going to start with the hand first, and then I'll go up and do the shoulder, underarm, and always wiping down. Then I will get my rinse washcloth, and I will rinse the hand, rinse the shoulder, the axilla area, and down. I will remove the basin, and I will remove the towel. I will cover the arm up. I will look at the instructor, and I will say, I will repeat this process on this side. You do not have to actually do that arm. Now I'm going to get the towel again, and I'm going to put it over the bath blanket, and this time I'm pulling the bath blanket down. So kind of hold it like this so that the person that is watching you cannot see any of the body part. Then I'm going to kind of do it like this. And now we're going to wash just the chest. This is just the chest here. I'm going to make my mitt. I'm going to put soap on it. And I am going to go up underneath the towel to wash this area. Now in real life, you will want to observe underneath the breast folds for any redness, skin breakdown, irritation, food particles, anything that is abnormal needs to be reported to the nurse. Now I will make my mitt and I will rinse the chest, and I'll kind of just pat it dry with this towel that's on there. Now this is two parts because now we're going to do the abdomen. So I will make my mitt, I will put soap on it, and I will wash the abdomen, also checking for lifting folds and again looking for anything that is abnormal. I'm going to make a mitt and I'm going to rinse that area and I will pat it dry. Now, as you pull your bath blanket up, you pull your towel, no exposure of the skin, and put your towel over here. We're now at the next critical step. Please take note of this. You go change your water after the abdomen. In order to do that, and this is a critical step, you must put your side rail up, take your basin, go get water, come back, put your side rail down. You cannot miss this part. This is a critical step. You can miss some of these other steps, but you cannot miss this part or you could potentially fail, or you would fail. Now we're going to do the legs, similar to the arms. So I'm going to expose the leg. Most of the time the socks won't be on, but if they are, we can just slip them off and put them into our hamper. And just like the arm, I'll take the towel, make it the length, long ways, and I'll place the towel. And be careful when you're handling these mannequins that you don't let these areas pinch your skin. Bend the leg, take your basin of water, and this usually works pretty good. Put your foot down in there, make your mitt, put your soap, go up to the thigh, way up here on the thigh, the inner thigh, the top of the thigh, the back. We want to get the back of the legs so that we don't have to do the back of their legs when we have them turned over, because many residents can't stay turned very long. Make your mitt, get rinse water, and rinse that same area. Of course, being sure that you get in between the toes. Support your leg, lay it down, put your basin away, pat dry your leg, paying special attention to in between the toes to get them dry. Cover the leg back up. We're again to another critical step. That is asterisk next to that step in your skill book. And I need to raise the bed rails. And go get water. We'll come back. I will put the side rails down. Now we're to the point to where we're finished with the whole front of the body. So I'm going to turn the mannequin. We always turn the residents with their shoulder and with their hip. Now I pull the bath blanket over just a little bit so I'll have some coverage, and we shoulder and hip with my hands like this. I will turn and just lay that mannequin up against the side rail. A real person would be able to hold onto it. Expose the back. Lay your towel down the length of the back. I know that you can't see the back right now, but everybody knows what a back looks like. And we take the washcloth, we put soap on the washcloth, and now we'll get the back of the neck, the back, and just the butt cheeks. We will not do the anal area till last. So we're just doing the back. So I've washed it, and I'm going to rinse. I'm going to rinse the neck, the back of the neck, the back, and the butt cheeks. I'm going to take this towel, pat dry. I'm going to get some lotion. I will warm it in my hands, and I will do a back massage. Then I will remove my towel, and I will lay the mannequin down using the shoulder and the hip technique. Laying them down and getting them comfortable. That is something you want to say throughout your skills at least once or twice, that you're keeping them comfortable. We are now again at another critical step. Have to put the side rails up to go change water. And I've got back, and I'm putting the side rails back down. And now I'm ready to do peri-care. Watch this closely, because in your skill book, it's just a little worded, a little out of order. I'm going to put my gloves on. I'm going to look at the instructor. I'm going to hold my gloves up, and I will say, I'm going to perform peri-care. I sometimes like you to say I'd wash, rinse, and pat dry the peri area. And then I'm going to take the gloves off exactly like I'm taking them off. Very important that we do this correctly. Throw those gloves away. Raise your side rail again, and just look at her and say hand hygiene. You don't have to go anywhere. Just say that you did it. Lower the side rail. And then I will say, I will put lotion, deodorant, powder as needed. I will put a fresh gown on, unfold the gown with no shaking. I kind of get it laid out the way that I want it. I expose this arm. I kind of get that arm ready to put in, slip it over. Kind of put this under the bath blanket, then pull it over to your side. You can lift this up and look under it. It's perfectly fine, and you have to do it sometimes. Just try to keep them covered as much as possible. Find the arm opening, slip the arm through, cover her up, and then I just usually just simulate that I'm tying a gown. Bath blanket back on, and then I'm going to go down here, kind of look and see where your sheet is, and get it over the feet and start pulling it up. Pull the sheet up. I'm okay if you pull it up to about the waist area, and then you take the bath blanket, you roll the bath blanket down, and you roll it away. This is the procedure for any linens that we take off the bed. Roll them down, roll them away. Put them in the hamper. Cover her up, try to get her nice and covered. We're back to a critical step of putting the side rail up. Side rails are always up when the whole bed is going up or the whole bed's going down. It's also a critical step. So we put the bed back down, we lower the rails, come over on this side, lower this rail, a lot of skills doesn't say this, but you can say clean up your supplies. And then critical step again, right there together, call light, raise your hands up, say hand hygiene, and report and record.